You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel FM 107.3 for Citizen Health Watch. Citizen Health Watch, your well body program.
This na CTN.
Pambul Adu and welcome to other edition of the program City and Health Watch with the Richie from the studio in Radio Mount Oriel FM 107.3 for Abbey College. Well, as we all know, City and Health Watch a program where they bring to you different things them but you well body one and but well body thing the way they happen at the country. Well, for this edition of the program, we go look at the relationship between flooding, sanitation and waterborne diseases. As we all know, it's not term way more especially than waterborne diseases here. And when we say waterborne diseases, then a sickness the way gets relationship with sanitation and thing the way get for do it. Water we not good way we they take in. But for help me talk about this more, I get Ibrahim Soikoma, we na the health education officer na the health education division Ministry of Health and Sanitation. So Ingo can help we for no more about this flooding, sanitation and waterborne diseases here. So we don't decide for bring can this week here. So we go start for basically talk first waiting a flooding, sanitation and waterborne disease. So we granny and we grandpa go understand what we try for talk about.
Normally, when we define flooding, now when boku rain, boku water, it come then it overflow, then it burst in the water banks, rivers, then it canal and the lower lands. Then something they can cause problem, it can cause even loss of lives and property. You understand? So basically, that's not the definition of flooding. But when we talk about waterborne disease, now this is the way they caused by water. Let me say contaminated or dirty water. We can link. You understand? People not really get actually can cause diseases like typhoid, cholera, even sometimes even hepatitis. You understand? Even water-related diseases can cause like malaria because we understand. Say when it rains, you understand? The outside of water they settle. You all know the problem of it also. They open things, you get gutters, you get tires, all of it. The water they settle, then it creates room for the breeding of mosquitoes. We all know say mosquito, now no more the malaria. And when once that happens, they are active for malaria, and they are active for waterborne disease, cholera.
Okay, so Ibrahim, you just don't mention cholera, then malaria, and other one. Then now the only waterborne diseases then this we get.
Remember, I tell you, say even you get typhoid, typhoid fever, they even get hepatitis because it's other people say even contaminated water, that is water dirty. You understand? Even can lead to typhoid, it can lead to hepatitis.
Okay, so waiting at the thing the way can cause for ladies water are so dirty because go day no more only dirty for himself.
Okay, like I say contaminated water. For instance, let me take example of cholera. You understand? When it rains heavily, we often say I don't tell you I say flooding. When the water can plenty, then it burst water banks, it go to the lower lands. Now similarly, there when it can heavily, it can boku one. But you will not say people then get the habit. Not only Freetown, but other places them with the poo, they left and the cookies. You open the vacation, they shit they put in a plastic. They send in a gutter we call Kellen. All these are poor practice. Now practice that we not good for our health. We all know say cholera it in a human. You understand? And when we shit, we send and just like that. It put your life at risk. People and they don't there. And when it can heavily, it contaminate it dirty water sources. For instance, we get pump them. You understand? Then pipe there the personal gutters. Then gutters there. Then pipe there also can burst. You understand? And when they can heavily splash by the water, and people know the other side they get the water. Then if they gutter there, so the water is splash, people get under, they get rubber. The water way they come on the pipe, they want to come on the gutter, they cannot go back. So they contaminate the water. They allow you not forget of the fact that get people away. The source of water or pure water, now water well, and the water well so they don't make them fine. You understand? When the water they can heavily, if they burst the bank of this water well or if they overflow, it can inside the water well, then it contaminate. And then when people then get the water, it lead them to cholera, it lead them to typhoid and other diseases. Them. So this is not the relation between flooding or rain can heavily, then and water source or sanitation. And another thing I want to talk about that because when they talk of sanitation, you understand? Now it get to do with people, you understand? Then people then you go see someone again a skyscraper, you see get 4-story, but again flush. But if flush, they maintain it properly, you understand? But let remember, see, you understand that flush the septic they leak. Then when it leak, it even contaminated water because when it come, it wash and maybe go down. And don't forget we get fly. I can say keke for most of the business because the fly when you don't para pupu, it take the germs with the pa. But pupu the way contaminated. They mama say if you get is any way you do, fly they go inside the house. They go sit down and food. They go sit down and place for sit down. So they put we all at risk. So I can see and say for to prevent any kind of diseases, there way contagious disease like the one there. So it takes your community because when you want to get for do it sanitation, it takes me, you, and everybody for will be safe. Especially in time when it rains heavily. This is the time when we dey at risk for cholera. Also, we don't get research people. So even in 2012, the most devastating cholera we don't get say it started in the dry season. Why don't they happen? Even you get practice and people they plant. When they plant, they water the plantation. But most of the time, the water the plantation is not correct. It's contaminated. And we all know Sinamaki. So now, for instance, the cassava leaves, they peel no more than bitter. Or depends if they cut no more, you just go buy them just like that, Some people know they wash them properly and just they can't cook and some know they cook properly. Or even the process self where you wash out or anything and they put you at risk. So we need to take all effort, you understand, for take the measures for preventing the thereby forcing you for do and for left for pupu in the open, that is to say open the vacation or pupu, you say in a gutter or you left it just like that and water come heavily, then you put all at risk for cholera and other diseases.
Okay, just like what you mentioned, so say the 2012 research being show say we get a cholera burden. So as at now, waiting at the current cholera burden.
Well, I'm glad you asked that question. For now, this is just the door for public education. As at now, we don't get any recorded case of cholera whatsoever all over the country. But no more we give people the sabi, the knowledge, because they say knowledge is power. If I would just say we intensify the one day because year in year out. Most times in terms we educate people and what they for do, for tap cholera, because not only do at national level, we get health education officers now, each of them this year where they roll out sensitization at communities. They get a community entrepreneurs where they utilize, where they educate people on the risk of cholera and other waterborne diseases, you understand? So that's the drive.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel FM 107.3 for CTN Health Watch. CTN Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget to this na a program at CTN's Health Watch, where they reach you from the studio na Radio Mount Oriel, FM 107.3 for Abbey College. Inside today's program, we talk about the relationship between flooding, sanitation, and waterborne diseases. Me where they make the program reach you, my name na Zainaba Mansari. And with me na Ibrahim Suri Koma, Health Officer, Health Education Division na the Ministry of Health and Sanitation. So in the management, for instance, of this cholera, so what are the key priorities or interventions we recommend?
Well, we then at the public education, health education and health promotion unit. What they do, they give people the knowledge is sabi. When it comes to the management, you get the clinicians. When you go to hospital, I make what they say, when somebody begin feel ill, you feel say you sick. The first thing for now, what they say, you call 117. After which, you will make another effort for reach the nearest health facility where master say people need for whatever condition where they persist with you, they're knowledgeable for able to address them in a way I believe say you go to the standards.
Now, this habit of for people and for defecate and contaminate water then around not a new thing. We all know say na common practice now we country.
Yeah.
So somebody go one for say for raise awareness, we don't do them, but still it continue.
Well,
so waiting at perhaps the level of water source protection way una don't put in place.
Well, you talk of water sources. I believe you talk about the infrastructure. The government can't do it all, you understand? Because when you talk of water sources, you get to do with pure water. You understand? So people never get water for drink, you understand? And government get partners and other well body and people we don't the kind side for the help in that area there. If you take an instance since independence or since the which is left here, the water sources where they are because the infrastructure not the same anymore. And Even with that, the improvement will happen, the war self can devastate the country when it talks of that. But with time, government, any partner, they don't make effort for to improve the water sources in the country, but that may not go be sufficient in as much as, we they get flow of people from other places, the kind of urban areas like Freetown, in other parts, and always there is competition. We always get problem for the one because with growing population, so the resources go be scarce. So we always give people the knowledge for them to prevent itself, take action for the young very safe at community levels, for able to tap diseases because prevention they say is better than cure. So you never can tell. But also it boils down to attitude. You understand? Because I don't even see some certain circumstances where they go to community where they engage people. Why una can get toilet, but una they decide for go now, let me say now a stream now go people. So I can tell you say no, boy go sit down there, they get fine air, they get fresh breeze, then it's attitude. Although they get the knowledge, say the best way to for defecate when you get a standard inside for toilet, we put life at risk. Some people, like I say, it's all boils down to attitude because even when you go defecate in the river, you poo, then the crabs save the eat them. Let we understand this. Some people know the cook them here properly, even the processing because crab, of course, we open crab, all wait till you see them. So that's normal. So even all the one in a risk, they put all our life at what boils down to attitude, and I make we do education. The only way we will change attitude, we all know say attitude is strength. I mean, we educate them to communication, to engagement, one-to-one, all of anything, and but they see the risk and they see the benefit for. Let the left for the habits for the health and the health of the country.
So if their attitude has to then behavior they has to continue and then practice has still continue, what think would be the implication?
Like I tell you, they put all at risk, but for some communities, some chiefdoms, then we don't institute some bylaws when it comes to health, even doing the structural doing the Ebola, because even though they do that with health program people in districts where they engage the paramount chief, then we get bylaws for some people away. For instance, about some of these sick can go hospital, we get bylaws for some people where they openly defecate where we get to a day. So I believe say then get bylaws where they don't institute where a penalty where they levy at people where you don't search in our communities. But like you say, in health promotion, when provide the required structures, health promotion will be effective. I mean we get partners where they can say if our government themselves, gradually they provide some facilities and services in the community. But it boils down to attitude. Because people they leave it to it, they go defecate. People then go they uphill, we gonna say difficult, but they force them for doing a public toilet, but when they do them, they go see them build shelter. But even shanty community, let me say even some communities, because we don't want to come like Bay, Susan's Bays, you understand anything and they
but Ibrahim, think say that get for do it the structural arrangement of the country as well.
Well, and it's a broader way. We just want for now down to which we be able for as Minister of Health. You understand that it's a whole ball game together with to discuss and because you get to with plenty other stakeholders.
But somebody also go say una dey in the position for like put heads together and see how best una go advocate as well as una dey advocate for let people and all they engage in such practices.
Well,
una for also they engage for let una make provision so that people are gonna make use of the facility.
Always against interministerial.
Because if you go inside town, for example, need to even find public toilets. So what are you expecting people?
Well, like how they tell you no more. The sanitation aspect has been devolved to councils. It's the responsibility of councils. What do we do with the partner? You understand? We self get a stake for people because it's a Ministry of Health and Sanitation. But because that part is being devolved to councils, there's no council. However, we can say for support and assist council live in the education area. If it's area, then where we do joint, implementation. You understand? But the issue of adjusting that issue there, we do interministerial and consultation engagement, but with that, it takes time for certain things to happen. Like make we thing to partners that we guys for support government. Government is overburdened. We can do everything at a go. You understand? But through time systematically, we are trying. We are getting right there.
Mentioning the waterborne diseases here, so you highlight malaria, and that's a new thing for me. For no say it gets for do with a waterborne disease. It might be something new for somebody else. So just for making clear, malaria categorized under waterborne disease.
Yeah, malaria not a waterborne disease. Malaria is a water-related disease. Okay. You understand? Why I say water-related? Simply because when it rains heavily, you understand, or we know the environment, you understand, we left things they open, or cup they open, or tire they open, or we gutter You understand? We get some holes, they will get pits them where we know they clean. Water they settle there. And when it settle there, now breeding ground for mosquito. And now only mosquito they give malaria.
Okay, so that boils down to sanitation.
So, yeah, sanitation issues. So let me say now water related disease.
Okay.
You know, and even sanitation.
So recently when I be engaged in sensitization and distribution of tents for malaria. So how far that process is done?
That process has been done long ago, and where we distribute 1.6 million bed nets all over the country, you know, systematically. First go on at the province, then we can do on Africa. And they don't well, we still do monitoring how people they make proper use of these tents, because you know, for give us the tents now one, but for they make proper use for the very purpose of the year when for sleep inside it properly for able to prevent them from mosquito bites, thereby preventing malaria is key. So that is the way we get from back on for we do monitoring in our communities, see, and we continue the sensitization, just like I don't give me the opportunity to tell them how to use them properly. We don't take them sleep there every night, you stock them properly, you understand? The other thing and the very key, although because from site at the distribution point they educate them properly how for use them, because just like all 10, because they distribute after every 3 years, so people they already know how for use them, but we know we're tired, we need for intensify for educate them further.
Okay, so now we faced with this COVID-19, then now it don't couple up with this rain season way with deeper, and like we mentioned earlier, and the 10 in this way we can get cholera cases especially, and now this sanitation very important to a new thing at the country. So how far I intend for going this sensitization, because also everybody they listen radio.
Well, like I tell you no more, you know, and Ministry of Health and Sanitation, anything we do now integrated program. Even like we talk about that bed net distribution. When we be the one community, we do on radio. You not just talk about the bed net distribution, we be talk about we keep people them key messages on corona prevention, and that's the same thing. Each district we get team of health education officer, we get health education officer, health promotion officer. Now every district where they go 10 to 10 communities, they engage people them. You know, they get community and get community stakeholder where they use, you understand, for sensitize people, for educate people on the risk of corona, you know, and the risk of waterborne disease, and on the risk of malaria. So now integrated approach all the time. Now we can do just like what in our body ministry for level with people with knowledge, you know, for level prevent first, then after which then we able to treat, you know, people them for the mobility and other thing when it comes to well body business at the country.
Okay, so most times waterborne diseases then can be like easily and widely transmittable.
Any contagious disease. Me no, like I can tell you, me no want to go too much into the clinical aspect, because we can pass on the information what people for do, but tap themselves against the disease there. So.
Okay.
But what I can tell you, see, most waterborne diseases, for instance, like cholera, and highly contagious disease, a very bad, you know, cholera, you know, inside 1 hour, you know, if prudent medical action is not taken, it kill thousands of people. You know, we don't get cases of that one in other countries there. Even Sierra Leone, the 2012 cholera outbreak, it was very chaotic. You know, we get lots of people that we lost their life through this cholera. You know, but I can tell you say no more, but it's preventable. Cholera and most other diseases, they are not about non-communicable disease, but infectious diseases, even non-communicable, is preventable. You see, but it left to we for take the prudent actions, because most of them here, diseases they I can say it's behavioral. Let me say for non-communicable diseases, and they say go the exercise, be like no do this, but still they do them. So that they make the booty at risk. But if you don't do anything, they prevent you. You need to get them disease then they just like cholera. They say wash your hand all the time, not eat food where you cover evidence, you know, and treat no gutter. You understand? Wash your hand all the time. You know, and get clean source of water. These are actions we do. We will do anything for prevent yourself against that disease there. So it's so bad. Most disease is attitudinal.
Okay, so regarding the flooding, over the years we don't get a lot of the cases there also of flooding in the country. So waiting on a thing say now the behavior the way they lead to this.
No, I want to tell you clearly, say, you don't take small no get flooding, you understand? But I tell you, say, it was on 2012, 2022 last year, cholera in the country. But, you know, even in 2017, you understand? We all say we get flooding in the country, then we lead to the most life. And if that telling, you understand? What we do, we mostly go to the communities, because we understand, say, at that time, people in that risk, people need water, you understand? We say, start people, maybe UNICEF and another partner, and provide water in other communities there, you understand? Because we make makeshift communities for people, and water is very key. At that point in time, we go there, we communicate to them, we educate them, say no, this is not the time we will put all other measures for we get safe and clean water in our communities. And I think say 2 other periods we will not get any single case of cholera away or cholera, the whole of the country. Yes.
Then somebody go on for say most times una dey focus on una sensitization na free to normal, whereas other areas then the way una not in touch, we very important.
No, that need not go be true, because what they tell you, so we say this on health education division. You know, the division is a multidisciplinary division. We partner with all other people. You understand? Most of the whole meeting, we get people who they invite. We partner with the religious council, community people, chiefs, paramount chiefs. You understand? We engage on a daily basis at community level. Like I tell you, we get offices all over the district. This office where so we get sub office at the district where they do similar thing. You understand? They engage partners. They go in communities. We know they work in isolation. And we work with key partners, and we said they do similar thing where we do, but with a focus, with a national strategy. They go in community, educate people, and communicate to them. For some of them, this guy they talk of for prevent people them, because prevention is better than cure, as they say.
So within basically required of community people in combating waterborne diseases and other things that way related.
I gotta tell you, most of them is behavioral. Then self can add them voice, because for instance, let me say you get like imam, they get pastor, the imam intimate na the mimbar, you understand? The pastor's the pulpit. It key behavioral messages when it comes to COVID-19, the risk of COVID-19, or also cholera. I've done they go Ukraine and think I say me pastor say don't talk. The imam say don't talk. Same thing with teachers, because most times we can engage teachers. Because understand the children or school going people are agents of change. We can engage them. So turning they will give them key behaviors way for health. When they go, they tell the picking them, and the picking they go now say me teacher tell me say papa, if you watch here only 10, where they sneeze, if you cover you want, or you do it on your elbow, or where you don't come up, if you watch here, mama not to dirty and I got when it rains. We all know say that it works, because I mean we engage all the key stakeholders there. So even let me say paramount chief. Most of the time, we're going to radio in a community, we're going to district. We utilize the paramount chief, they're going to radio, you talk all over the district, the area. So with that, we believe say it get some impact. We all know say behavior for change, it's trend. It take time, understand it. It gets certain levels, but with time we are getting there.
Okay.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for CTN Health Watch. CTN Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget to this na program at CTN Health Watch, where they reach you from the studio na Radio Mount Oriel, FM 107.3 for Abbey College. Inside today's program, we will talk about the relationship between flooding, sanitation, and waterborne diseases. Me where they make the program reach you, my name na Zaina Barmantire. And with me na Ibrahim Soyi-Koma, Health Officer, Health Education Division na the Ministry of Health and Sanitation. Well, now na time for news. After the news, we will come back and continue with the program.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for CTN Health Watch. CTN Health Watch, your well body program.
This na CTN.
Welcome to the second half of the program, CTN Health Watch, where they reach you from the studio na Radio Mount Oriel, FM 107.3 for Abbey College. Inside today's program, we will talk about the relationship between flooding, sanitation, and waterborne diseases. Me where they make the program reach you, my name na Zaina Barmantire. And with me, I get Ibrahim Soyi-Koma, Health Officer, Health Education Division, and the Ministry of Health and Sanitation. We will continue with the program. In talking about then sanitation, especially the dirty area, this somebody go on for say una need for work with the council and the country. So, waiting our relationship with them.
Well, like I tell you, say the issue of sanitation is very challenging, but it has been devolved to council. We at national area and at the district always, then get a committee where they can set when it comes to sanitation, when it comes to health issues. And council can be part of the meeting and council can also invite the DHMT, because in the district we have got district health management team. And where that district man, they under council at the district. You understand? So they are not working in isolation when it talks of the district, it's one and the same. Although that sanitation aspect has been developed to council, but they are working together for to address the issue of sanitation at district level and at national level.
Okay, so far on the COVID-19 issue, waiting on be the role of the health education division.
Of course, it's very big, because when you go even at NACOVAC, you get the risk communication unit. You understand? You know, so you get social evaluation unit, you get risk way, then make them all in one. But the risk communication unit, where na my boss, when Mr. Thomas and the champion now, you know, directly now the program manager of this division at the health education division. You can see say he is the most technical lead. Where, you know, most times they give the technical directives, you know, even most times you see press conference, they address certain critical and technical issues. So this division, let me say, it placed itself into the area of when you talk about health promotion, risk communication, when you talk about COVID-19 and other, because this COVID-19 are just an outbreak and any other thing can happen, but this division, they take the lead in terms of social mobilization, in terms of risk communication, in terms of behavior change communication for health-seeking behavior in our communities and the country as well.
Okay, as the health education division and at the Ministry of Health and Sanitation, how now go rate the level of compliance of people and towards this COVID-19?
Well, if you talk about rate compliance, I think it has to do with, you know, with a study. If you, I don't want to talk something hypothetical. Okay. Yes, I want to let it inform with research. You know, but when you talk of the compliance, you will say society, they dwindle society, it look like the up. I mean, you see the police, they try for flex the muscle for see the people adhere to the key preventive behaviors. For instance, like the area of use of face mask. You know, then the compliance can go up and come up, because when the government be make a mandatory that people use face mask in public, because that's the key message. You understand? Within that first 2 weeks, you know, the compliance will up. But if you say travel a lot during that period, you understand, and then it be later calm down, because you can understand. So when they call something, you will see it, and later, you know, then see it because of such other reason. But with time, I say the police don't they try for, you know, and scale up that, then ensure say people then take up the use of face masks, because face masks are one of the key behaviors and way research proves say effective for the prevention of COVID-19.
Okay.
Backed up with other, you know, key behaviors, because all we know say using our face masks only not ensure 100% protection, but the combination of all the other key behaviors there, like social distancing, we want this like elbow, that kind of thing, and they all the one and they put together and they show you, let me see, and say 90% or more, you know, protection against COVID-19.
Okay, so now that we dey in the season where we can mostly dey at risk of them waterborne diseases here, like this cholera here, so we now we topic sentence. Una get any activities where una don't line up for perhaps reach out to people and engage them?
When it comes to, you know, the area of this waterborne diseases,
yes.
Like I tell you no more, you know, like I tell you say we get their officers in the district. It's part of their routine. It's part of our work. You know, going to the community, because like I say, we do integrated approach. Where we do the outreaches. You know, where they do our communities. You understand? And even at the district, we get interactive discussion program supported by UNICEF. And then the program there, 10 to 10, they utilize them for educate people. They even call the paramount chiefs. They even call other stakeholders for come talk to them people on the risk and what them for do for tap the sickness like cholera, you know, even corona and all of that.
You've been they talk earlier and you continuously mention say na behavioral or behavior something. So perhaps una need for changing our strategies the way una don't do.
Oh, the thing is, you know, say in communication, you must get a strategy. You understand? And we open up to mixed strategy. 10 to 10, we can change the strategy, you understand? We use the most appropriate channel of communication for each person, you understand, for changing behavior. But again, like I tell you, behavior change, not a trend, not to one green day. You get level, say you go meet this person, say it at level 2. Then with continuous engagement, you will see say you don't at level 2 or 3 or 4 as the case may be. But then all are trends. So we need to do some kind of a perception study, you know, more research for what we able to understand, you know, because behavior change is a science, you understand? And so we need to do some research where we know the level of people and behavior when it comes to responding to health and come to the behavior, you know, when it comes to the health thing we talk about. Okay,
so you think say this sanitation get any relationship with poverty in a country?
Well, sanitation, me, I believe say is not linked.
Because most times if you hear people they talking, we tell you say advanced countries and you know they but we can't to developing countries because of the poverty.
What you have for see, it's a kind of system. For instance, you know, Sierra Leone has not to buy in the idea for pay for the naughty. Other countries is okay. Me say that they pay for me dirty. What is bad for that pay 2,000 euros every week for a vendor for can take me dirty? You go to where am. Instead they wait where you come, then put on a water and a gutter. You go down. Or what is bad if you before you build those, you dig a standard toilet? You know what is bad if you poo na toilet all the time? But what you know fine for you cannot open. You understand it, you poo. Then even if you're client, we understand see some people them they go na bush. Now that's say they find pleasure for poo. They just left on that way there. But even if you want to do them, we always in a bush. It is recommended that you dig deep. Then you poo you cover her. Where even dog or other animal no can open and get and lose where you can wash them away, you go contaminate water sources. All of these are they tell you say it is not entirely linked to poverty. It's a behavior. It's the mentality. You understand? Other countries and they even will dirty. You want to answer, you watch out for say even for PCSF, you will say it's not ideal. It's about our attitude. It's about our behavior. You know the mentality. You understand? People don't want to pay for them dirty. They visit Wataka away in Canada opportunity for 200 days. Why? What is bad? 2,000 euros. You know, for pay for your dirty way you don't accumulate inside you. What is bad in that?
Well, are there the services also?
Of course, yeah. Me, not because I'm talking. You understand? Every week, a vendor the way they go, it might go wake myself every Sunday. You know, get dirty they win and they. If they go, dirty they go, then thing and they. I don't see that a lot.
Perhaps you could be a lucky one for the.
No, not lucky. Who say me they live naive Eastern? Naive Eastern. They go knock doors. You get dirty they go. Clean some nothing and they.
Okay.
You know, so it's practical.
What did it take for change that mentality there?
Well, it's continued education, continued awareness raising, continuous engagement, person to person. You know, even the journalists they get part for help with this for do a lot of opinion pieces, a lot of educational pieces in terms of even other things and for let we able to educate specific groups. You know, even the people who matter. You know, sometimes they even find them utilize stakeholders. Let them make a kind of commitment statement in terms of renting and for able help for level change people perception. Because perception and behavior, I believe they're linked and it pays when it comes to health seeking behavior.
So what will be your recommendations in terms of this sanitation, waterborne diseases, flooding? What would be your recommendation if you make any recommendations?
Well, I want to talk on the part of the people enforced because me always the focus because this office they deal with behavior change communication. You understand? We always talk to the people. You understand? For instance, when you talk of them diseases, they're like malaria or anything, like we they do the required behaviors. Them we tell what you need for do. You understand? Because some people feel say any malaria. You understand? And now we drink beer. Now they get or now we drink juice or other thing, you understand? Where is so correct. These are all things we're not correct. Research proven. It's of course clear, say medically and research based. You understand? Now let mosquito and then malaria. Nothing more than that. So one people take the prudent action first, for clean the area. Because we'll talk about malaria prevention without proper sanitation. Don't forget it. So also again, people have always they sleep inside mosquito tent all time, every night in the family. You understand? So then also for this cholera prevention and waterborne disease, it's of course clear. See, people for always the source clean water. You understand? If they make you water well, make it in a way that way if you water cancer or get in the issue of flooding, water not go go inside. Way then the way they do and way in a proper way. You understand? And then with the front of people and way they poo na the open, that is open the vacation when the people just left and so dog they go there, water they come, then they flash them, you go to water sources so they get clean water. Thereby you don't put a post at the other hand at risk for cholera and the country in a big body when they get outbreaks of cholera and other diseases there. The country lost a lot and we spend so much and the country they can't be. Again, people they always urge them say, if you don't get way, then you don't get water, right? It is of course clear saying we they promote say people for the boil water. If you see say you don't get water through the rain, you don't get water where you think say not too safe. It's advise you that if you don't get water, money for buy pure water, boil them before ever you drink them. And we all know it's like season people they harvest water a lot. And I don't see people because we all know say when when season the water it can does not depend because it dust they can't see don't they? And dust na carrier of most germs. You never can tell. You don't get that water, they go drink them. So you don't put yourself at risk. People who for practice for the boil water. Boiling is very doable, it's easy, and it's cost effective. You understand? Some people you go see them put the rubber out of the rain, see they get at the water they can. Then you never can show. The atmosphere is polluted. They don't stay there, you can never can tell. So now they say people for boil water, if you're not able to get money for access, pure water as way other money man can do. You self king for protect your life and your family. Boil water where they use for drink.
You want to know but plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for Citizen Health Watch. Citizen Health Watch, your well body program.
This na CTN.
Listener, if you just stay tuning, not forget say this na a program Citizen Health Watch where they reach you from the studio na Radio Mount Oriel, FM 107.3 for Abbey College. And inside today's program, we will talk about the relationship between flooding, sanitation, and waterborne diseases. Me where they make the program reach you, my name na Zainaba Mansari. And with me na Ibrahim Soyi Koma, Health Officer, Health Education Division na the Ministry of Health and Sanitation. In the area of people where they defecate in the open, perhaps somebody go want for say now because effective laws they know they or like una monitoring not that effective for track them kind of people in there because now a common practice.
Well, you say monitoring, council, I'm not for talk of council, but the government not go there everywhere. You know, I make with you make use of community stakeholders, paramount chiefs, idman, religious leaders. You understand? Because even me, responsibility for see somebody they poo in the open. Say, oh, stop this way they do so. If you don't know, they go to the chief or you go important to the chief. Please, it takes all of us to have responsibility. Because imagine you're not person the poo is infected with cholera or any other disease. Then thereby you never can tell when I picking or infected or you. They put the whole country behind. So now it takes all of us, you understand? For let we address some of the issues there. So we own part the government and partners and everybody. They say we don't go throw the stone to one person now you and the 4 9 responsible. No. Council get their own part when it talks of sanitation because I tell you they don't devolve them. So council serve try their own best. But the country we can never get it right all together one thing. A process and a time.
Okay. So let's assume say somebody happen for get this cholera. What's in if or do?
Well, like how they tell you, because you sometimes by 10 chances to 1 you get infected. The first port of call way you can call 17, and then again, but even while you try for call 17, if you try for access because we health facilities they're open all the time. You understand, all over the country. If you don't apply, every village now it gets a radius of a meter where you will meet a health facility where you have access. And Master Saib will all the time for take care of people when it comes to that kind of situation.
And talking about this accessibility of health facilities, most people they shy away from health facilities right now because of fear of the COVID-19.
That is a very good point. You understand? And I want to make it clear, say, all health facilities, we get specific health facilities and where people they go where they treat people with COVID-19. You understand? It just not like all time. We have facilities, PHUs, the health centers all over the countries. The services that we don't give them, just take time. They always they even now they talk so because we don't fair not say people or Beloma they need to go for the ANC services. That is wrong. They put yourself at risk. You understand? Imagine if you go to hospital a maximum of 8 times, then you go. You understand? Then if they put yourself at risk, anything happen to you, would go there in the house for them to attend to that kind of complication or anything. So if they put your baby at risk, yourself and the family. So you see, we know they promote that when you, for instance, Beloma go to hospital, just like where you don't do, just like all 10. But some people they not to their hospital and health facilities and they treat corona people there. And also picking under 5. We all know say they get the routine services the way they get in the hospital. Like the maclate, then polio, then BCG, all of them, the measles, rubella, all of them one day. Always there in the health facility all 10. You picking, within the house, if they sick. Yes, a needed services then they put you picking life at risk. You understand? And when you for take action for prevent the picking from dying and other things we go meet them as a result of you inaction. For let the beginning get the health services there as well. You understand? Then also because even woman way they give up it's of course clear say for even hospital because then get for talk to them they cancel them if the woman all of them thing and no forget say Maria is in a bad sick. When woman they in pregnancy the first visit where they make they give a mosquito tent and they cancel them they even give anti-mosquito treatment. You understand? And they even picking where they go for penta they get malaria service where they get free of charge, free of cost. So all of them why you go prevent you when a below man and you picking under 5 picking from their service they wait per government they give say this is not free because of you say the free corona. No corona no na the hospital there so. We get specific side we master sabi people them. They take care of people them where they cannot say they get the corona tumbu by them. And also the services that we government don't they all 10. Instead in all the hospital them or health facility all over the country way for belly woman, bikini under 5, other kids and for visiting facility for learn again getting services because you know find there with the first coronavirus people they afraid say corona then people they die from malaria people die from other illnesses and people, belly woman they die because we all know say maternal issues now see problem in this country you know because this will not make even so hard because some people they go there now also say you know you do that home delivery what they against with the preach with the promote institutional delivery go to hospital there you go one day anything happen to personal people and they go take care and save your life and the picking life you know because if you born a house thing go happen to you never can tell you go beyond control you know they promote that one day many people never always visit the health facility when it comes to routine health services you get special side them where people government with body ministry make for it corona people.
So basically then health facility are safe.
Very safe. It's just like where you know sometimes you don't born 3 times. You first speaking, you take another facility. The second one you take another. Nothing happen with them. We health facility are always safe. You understand? Even if we body people they put up the best standards for like protect you and then save us against coronavirus and other diseases.
Listener, if you just stay tuning, not forget to listen to a program City and Health Watch where they reach you from the studio na Radio Mount Oral, FM 107.3 for Abbey College. Inside today's program, we dey talk about the relationship between flooding, sanitation, and waterborne diseases. Me where they make the program reach you, my name na Zaina Barmansre. And with me na Ibrahim Suri Koma, Health Officer, Health Education Division na the Ministry of Health and Sanitation. This COVID-19 is worrisome and we all know it's the most important health problem right now where we get in the country. But people they raise concern say the attention don't be shifted towards COVID-19 and other sickness like we be mentioned like malaria and this cholera sensitization not seem for be low in the area then they.
No, well, like what you talk almost say, you know, shifted. But I don't go agree entirely because even in the corona period, you know, we distribute tents all over the country. Where that neighbor say, some people will say, no, what happen? You understand? Eh? But it still they happen. Other services they happen at the communities. People they do outreaches because recently update on Kalili, you know, I go support them on this COVID-19 fight. We get a lot of integrated approach within our community. Even this way you talk to people in the Canada facility. We talk a lot at community level. We talk to paramount chiefs say we need for skill up people and we need for give them more awareness for them and visit the health facility because we don't identify that one day as a problem. So we don't go there and we do integrated approach. But it's natural. Any kind of disease, we all know say we don't get Ebola in this country. And people still get that kind of fear. So that make the only thing we go solve that na communication, engagement, and just like how we do so. And we do all over the country. And people don't see dividend, people don't come slowly at the health facilities and for routine services for belly woman, you know, for picking on the fight and all the killer and people. And we need health services.
Okay, so in the area of distribution of tents, this also the first time una don't do them.
Yeah, we don't do them.
I believe say una can get a data of the distribution and perhaps the compliance of how people they use them tents. So I wanna go access the compliance.
Well, if you talk of data, I may not get the data now. I tell you, say, pass you go to the malaria control program.
But when I think say people they make use of them facility there.
No. When in terms of the bed net use. People they make use of them, but the only issue we get with them are the proper use. So man get the tent, but for make proper use of them an issue. We scale up, you understand? We send at community level, on radio, on whatever platform we use for each people and on the proper use. If we make a TV spot, our people for make proper use of this tent here where it is in circulation. You will not say, you know, upline no will get them, but with people in that community level for educate them. If we put in a form of awareness cards, our people for properly use tent. When even a flashcard, you just say you go share at first sight. You see, as soon. These are the process why they go for lab use and make use of the tent.
And most times we see them tents as soon as marketplaces and people they use them for fishing and all, and the habit still they continue. So what we now don't do is in that area.
I'm glad the way you talk of fishing. You understand? We talk of proper use and the misuse. You know, we always preach proper use, but time and day again, we don't understand. Say people didn't make proper use of them tent here. One way point this fishing. You understand? Then also some people they use them for Thai food. You know, and for bag, you know, cold. All of it say to proper use. Some people they use them for harvest mango, other tinem, other food. And they want to the proper use. Imagine Papa government putting money, you know, and partner them for buy them tent here for going free of charge. They will not go make me use them for fishing or do other thing. You know, correct. Then they in action on your own part. You understand? I mean, they preach people that make proper use of 10 and also then they get even you they go use them for fishing. Then 10 targets from waiting proper. They even above the marine life and the water. So might go fishing, you don't get fish again. So you see that kind of thing in there.
Sanitation na a broad word and it entails a lot. So just for break them down, for make that layman understand what is sanitation mean as in this context for it all.
Well, I'm for the understanding of people. Sanitation get for do with cleanliness. You get for do with poo or they say shit. You understand? Because now the let me say medical understanding of sanitation. You get for do the how they take care of shit to poo. You understand? We not say an issue that is going. They also backed up with cleanliness. Because if you never take proper care of your poo or your shit. You know, they put yourself at risk and everybody at risk. Then let me say, even you dirty, where they call the fly go sit on, you go sit now, they put all at risk. So sanitation, we own local time, we know where we go put our level understand why they take care of your shit, your poo and your dirty.
So somebody will go listen this program, sometimes you know understand better the program. We want for say, sometimes cholera don't come out the country. We get any reason for be afraid?
No, like just allay the minds of people. Them say, you know, we don't get any reported case of cholera of whatever all over the country where they talk. We do this, we talk simply because we give people and sabi the knowledge. You know, for public education reason, for people to know which everything for do when it comes to the prevention of cholera. First of all, they know the risk. You understand? Then they will take actions for preventing themselves and their family and the country against any possible outbreak of cholera and any other waterborne diseases.
Okay, so what do you basically want for left with it?
Well, like I just say, you know, we can't do it all by ourselves. And for call, you know, the people who they listen, we say, use yourself where they listen me so you get actions for take. Follow prevent waterborne diseases like cholera, especially when diseases they cancel. Then also, you know, we can able to prevent malaria in our community by sanitation. And if it is what it also sanitation play a part. Then partners cannot do it all by ourselves. People that don't always they work in sanitation. You understand? They want for say they don't do it for intensify more effort. You know, make easy work. And again, I want to talk to people and wait please they don't get stuck in this. You know, the private sector. You understand? Public-private partnership it pays because imagine I they do a sensitization and I get a poster on the risk of cholera. Then I see, for instance, I put a logo. You understand? Then it help for market institution, you understand? It's part of the corporate institution image they build for now. You understand? Or we do a jingle, you name the or we do a TV spot, you name the You understand? All that is part of the support we do. Then in return, we they sell you understand? I believe so. Then it pays because other one they know they do or they still call people and say they can be supporting this because even for instance we get cholera, even you business video one, you know go thrive, you understand? Because you need people, you understand? The people are your clients, are your customers. If they are not healthy, how would your business survive? So it's difficult. So like that.
This quick one, you think say we go able to reach that zero malaria target?
Yeah, we are reaching there because other countries don't already achieve them because for instance countries like Gambia, they're almost on to the stage of eliminating malaria. Why not? We can do it. You understand? We have more resources, we have everything, we have the knowledge for them. It all boils down to the knowledge, you know. People's knowledge on some of them this year is appalling. So when they take the right action, he know say this I for do this. Some people they know say that malaria and mosquitoes they give malaria. But he say no, not say they give malaria because of you get other things away now thought processes where they influence where they think. The sooner people then begin get that kind of understand, just like how they educate them because it takes time, not to want it. Because you don't talk to a person, next time they come back, perhaps it was them the first day will be time. So now that.
That's Nabi Ibrahim Soikoma, Health Officer, Health Education Division at the Ministry of Health and Sanitation. Well, as I go draw the cutting down for today's City and Health Watch program. Plenty thank you for who join me at the program. In case you miss part of the entire program, tune in again Monday afternoon for a repeat broadcast. Me we don't make the program reach you. My name is Zainab Mansiri.
You want to know about plenty sick them or well body business? Join Zanaba Mansari every Sunday after the 6:30 news summary and on Monday after the 12 o'clock news on Radio Mount Oriel, FM 107.3 for City and Health Watch. City and Health Watch, your well body program.
This na CTN.